Yes, this morning we are learning much more about the first patient diagnosed with Ebola in the United States. Our Dallas station KTVT identifies the victim as Thomas Eric Duncan.
United Airlines confirms Duncan flew on 2 of its planes. He first went from Liberia to Brussels. From there, he took United to Dulles Airport near Washington, then on to Dallas. The CDC says there is 0 risk of transmission on any of Duncan's flights, but Manuel Bojorquez is in Dallas, where miscommunication at a hospital may have put more people at risk. And well, good morning.
Good morning. The patient remains in serious condition in an isolation unit here at Texas Health Presbyterian Hospital. Officials are trying to calm the public's fears. At the same time, the hospital is trying to explain why the patient was not placed into isolation after his first visit to the emergency room.
Professionals on every level of the chain of command know what to do to minimize this potential risk to the people of Texas and of this country, for that matter.
Texas Governor Rick Perry tried to contain the sense of uncertainty in a community on edge after a man from Liberia tested positive for Ebola in Dallas. Hospital officials admit a nurse learned the patient had recently traveled from Africa during his first visit to the ER last Friday, but say that information was not passed along.
And as a result, the full import of that information wasn't factored into the clinical decision-making.
Health officials are monitoring 12 to 18 people who may have had direct contact with Duncan at this apartment complex where he was staying with relatives. Some have been isolated at home. All are being checked daily for symptoms of Ebola. That number includes 5 children who attend 4 different Dallas area schools. Officials say those schools will be getting some extra cleaning as a precaution, and they emphasize the children have not shown any symptoms of Ebola and believe the student population is safe.
We're going to keep going, business as usual, school will be in session.
But that didn't stop some parents from picking up their kids from school early. Others say they plan on keeping their kids at home. The CDC says people should not panic, but they should be mindful that the world is a global village where an outbreak overseas could find its way anywhere.
So this is a fact of life in the United States now?
I think it's a fact of life anywhere in the world now.
Anyone who had contact with the patient, including members of the emergency room staff here, will be monitored for 21 days. And if anyone should develop symptoms of Ebola, we're told they will immediately be placed into isolation. Nora?
All right, Manuel, thank you. USA Today is reporting that Texas health officials are monitoring a second possible Ebola patient. But this morning, we learned from Dr. Tom Frieden, the head of the CDC, that that report is not correct. In Hawaii, a hospital is keeping 1 patient in isolation. Doctors say the person may have Ebola, but the symptoms could reflect a number of illnesses.